My name is Anselm Anyoha. I am a board-certified pediatrician who has been in practice for over 25 years. Part of my job as a pediatrician is seeing and attending to newborns and their caregivers during routine visits, which begins when a baby comes home after birth from the hospital. Babies are usually less than 1 week old when I see them for the first time in my private pediatric practice. I also attend newborn deliveries at hospitals. In that capacity, I attend to babies immediately they're born, when they're only a few hours old, and as well as make decisions when to send them home at age 24 hours or 48 hours or 72 hours. In addition to my daily interaction with babies and their caregivers, I also have a master's degree in infant and early child development. All these experiences enabled me to put together the presentation which I believe will help caregivers improve their relationship with their newborns.
This presentation is centered on ways to improve the relationship between caregivers and their newborns. Listeners will also learn about the 5 caregiver-newborn relationship enhancing tools. A quality relationship between a caregiver and their newborn is a relationship based on 1, the understanding of the newborn's feelings, and 2, being a sensitive and engaged caregiver. It has been shown that quality relationships between newborns and their caregivers leads to infants and children with quality social-emotional health. Infant social-emotional health refers to the ability of the infant to develop healthy emotions, such as expressing their emotions in a healthy manner, including smiling, happiness, sadness when they need to, as well as empathy and getting along with peers. Optimum social-emotional health in infants is essential because it is the building block for ongoing learning, speech, language, and thought development. Many caregivers tend to raise their babies the way they were raised or the way they see adults around them raise children, which means that sometimes raising children comes instinctively, doing what comes natural as caregivers. But is that enough? We've learned enough about how babies develop and mature and how they acquire knowledge and social-emotional health. Therefore, pediatricians should start the conversation to raise awareness of the importance of quality relationships between a newborn and its caregiver. Before we dive into ways to build a quality caregiver-newborn relationship, let me remind you that a quality relationship between the caregiver and the newborn is a relationship based on the understanding of newborn's feelings, as well as being a sensitive and engaged caregiver. Through extensive research and hand-on experience, Doctor Anselm Anyoha developed a tool called Social-Emotional Targeted Anticipatory Guidance, or SET-AG. This tool helps caregivers build a stronger relationship with their newborns. The Social-Emotional Targeted Anticipatory Guidance, SET-AG tool, shares ways caregivers could build quality relationships with their newborns using 5 relationship-enhancing concepts. These concepts were developed over the years by researchers with interest in building quality bonding between mother and their newborns, and between caregivers and their infants. The 5 elements of the SET-AG tool are: 1. Caregiver sensitivity, taking action to alleviate discomfort in the newborn. 2. Communication, awareness of the many ways babies communicate. 3. Calmness and regulation, soothing and providing a calm environment. 4. Affect attunement, getting into the mind of the baby. And 5, synchrony, real-time engagement. These 5 elements capture the essence of bonding between mother and child, caregivers, and their newborns. And they're also easy to share with caregivers in primary care pediatric offices and clinics. Here's a question for each of the 5 elements in the SET-AG tool. Caregiver sensitivity. Could a baby be spoiled? Communication. How do you think babies communicate? Calmness and regulation. How do you think babies calm down? Affect attunement. Could you tell how a baby is feeling at any time? Synchrony. Do you know when a baby is ready to engage? The idea is to begin a conversation with caregivers about the importance of early caregiver-newborn relationships. Each question is an opportunity for dialogue around the subject. In the next few slides, we will share a clinical scenario and how modern-era pediatrics uses this in practice, starting with element number 1, caregiver sensitivity. As we already learned in the previous slides, sensitive caregivers promptly recognize infants' discomfort and respond with positive actions. When a caregiver repeatedly ignores an infant's approach, the newborn might get discouraged and stop trying to reach out to the caregiver, which puts a strain on their budding relationship. In this instance, attend to a baby who is fussing. Your newborn will not be spoiled. Picking a newborn up does not spoil them, but strengthens the newborn-caregiver relationship. We know that babies cannot control their sensory system, nerves, which drives their needs. They fuss and cry when they're hungry, and when they're uncomfortable, like having a soiled diaper, cold temperatures, and loud noises. Many things could irritate them. It is also true that babies need calm and regulation to be able to learn from those around them and engage in activities. A well-rested baby is a baby who's ready to learn and engage. Sometimes babies calm themselves by sucking on their fingers. On other occasions, caregivers could help babies calm down by holding them or swaddling them. Some infants prefer the calm, quiet environment with the light dimmed. Newborns are born with their own peculiar communication abilities and styles. Their ways of showing affection is also different from the ways older children show affection. They grasp people's fingers, root for breast nipples and bottles, cry to attract attention. It is necessary for caregivers to understand and to respond to the newborn's gestures and communication styles. Response to babies' ways of communication not only enables them to improve, but also stimulates the corresponding areas of the brain and body motor system that orchestrate these communicative efforts. Experienced caregivers know that even the level of a baby's voice could signal different things, with one pitch meaning that I want someone to come over, and another voice meaning I want to be picked up or fed, or that I'm soiled. The same goes with the firmness of their finger grips. Even silence could be a communication signal. It takes determined effort to appreciate the many ways babies communicate with their caregivers. Responding and being a communicating partner with your baby increases caregiver-newborn bonding, enhancing budding relationships and leading to quality social-emotional health of their newborn. Affect attunement has to do with imagining what your baby is going through or has gone through. This is obviously done through trial and error. For example, when a caregiver wonders when a baby is hungry or sleepy or tired, they're actually trying to figure out how the baby is feeling. In trying to figure out what a baby is going through, a caregiver might pick up the baby, look into their face, hold them, or try to intervene in different ways in order to find out which one works to comfort the baby. Therefore, many parents and caregivers engage in affect attunement without knowing it. It's difficult to peer into the mind of anybody, especially into the mind of a baby. But as a caregiver, we should try to imagine what babies are going through in their daily life activities, what it feels like to be a baby, and provide comfort and support when necessary. A gentle hold, for example, not only feels physically soft to the newborn, but also emotionally comforting and reassuring. Therefore, caregivers should endeavor to attend to newborns and infants with deliberate caring and effort to create positive feelings associated with physical and verbal contact. Quality relationships arise, develop, and blossom whenever caregivers and newborns enjoy moments of uninterrupted mutual engagement. It could be occasions when parents and newborns are engaged in mutual eye-gazing or smiling and enjoying each other's company. It could be in moments of intense body contact, such as hugging, holding hands, playing peekaboo. Making out small times for such moments adds quality to the relationship between the newborns and the caregiver. There are many opportunities for a caregiver to actively engage with their baby. When the baby is taking a bath or being dressed, or when the baby is awake, are opportunities. Doctor Anyoha recommends to engage as much as the baby can tolerate. Throughout this presentation, we shared the importance of quality relationships between newborns and their caregivers to the social and emotional development of the child. We also learned that optimum social emotional development in your child is the foundation for acquiring words, language, speech, and brain development. We also looked at real-life questions Dr. Anyoha uses in his pediatric practice. Practicing some or all of the elements will enhance the bond you have with your child. Remember, the relationship between caregivers and their newborns are the foundation for further child development. Relationship practices start the day a baby is born. Babies are ready to begin bonding and ready to begin forming relationships with their caregivers. Poor engagement with caregivers might lessen the baby's capacity to grow socially, emotionally, and could limit their developmental milestones. Parents are emotionally and actively involved in discussions concerning their newborn's feelings, social and emotional growth. Parents have strong opinions and beliefs on the subject matter, including how to raise their newborns and infants. A baby of only a few days old is full of developmental potential. What might happen at age 12 through 15 months? Look at the full emotional expression on this baby's face. What an abundance of emotion. This baby is ready to engage with the caregivers and his immediate environment. Realizing the full potential of children takes a lot of support, back and forth interaction, and other quality relationships practices we discuss in this presentation. Without active and continual caregiver relationship and support, a baby might not develop into their full social, emotional, and motor capacity. Thank you for listening. Please email modernera.pediatrics@yahoo.com for questions on this presentation or additional resources on SET AG.